Hi guys, welcome back to my channel. I'm here. And today we are going to talk about autoimmune joint diseases. What are these? How do they affect our joints? What kind of symptoms would a person have with this type of disease? And lastly, what can we do for these conditions? So without further ado, let's get into it. So what are autoimmune joint diseases? These are basically conditions where your immune system attacks your own body. In particular, in this case, it attacks the joints. Why does it do this? Well, we don't really know. A lot of things can trigger an autoimmune reaction. It could be genetics. It could be environmental factors. We just don't know, but at the end of the day, it is your immune system mistakenly identifying your own tissue as foreign and then attacking it. Now, the most common autoimmune joint diseases that we see are rheumatoid arthritis, psoriatic arthritis, gout, and lupus. With all these conditions, the hallmark or the main thing that we find is inflammation of the joints. That's because when your immune system is attacking the joints, the body gets this inflammatory response. And so any joint can be affected by these conditions. However, some joints are more commonly affected than others. For example, in rheumatoid arthritis, we tend to see the small joints of the hands and the feet being affected more commonly. Whereas in psoriatic arthritis, we tend to see the larger joints like the knees, the ankles, the elbows, the wrists being affected more commonly. Now, this is not a hard and fast rule. There is definitely overlap. But if you've got, let's say, pain in your small finger joints and your big toe joints, it's more likely that it's rheumatoid arthritis. If you've got pain in your knee and your ankle, it's more likely to be psoriatic arthritis. But again, there is quite a bit of overlap. The symptoms that you might experience with these conditions include joint pain, obviously joint swelling, stiffness, and also sometimes limitation in the range of motion of the joints. Now, with autoimmune conditions, it's not only the joints that can be affected. For example, in rheumatoid arthritis, we often see the wrists and the elbows being affected. But we can also see the eyes being affected, so a person might get what we call dry eyes. We can also see the skin being affected with rashes. And in some cases, we can even see the internal organs being affected. For example, in systemic sclerosis, we can see the lungs or the heart being affected. So how do we treat these conditions? Now, treatment-wise, there is no cure for autoimmune joint diseases, but there are treatments available to help manage the symptoms and also to slow down the progression of the disease. And so treatment will vary depending on the condition. But generally speaking, we try to do two things. We try to control the inflammation, and we also try to control the immune system. And so the way we do this is through medications. Now, these include disease-modifying anti-rheumatic drugs, DMA or DIS. These are medications like methotrexate, leflunomide, sulfasalazine. These medications help control the immune system. And the other class of medications that we use are the biologics. Now, these target specific parts of the immune system and they help dampen the immune response. And so examples of these include adalimumab, etanercept, infliximab. And sometimes we even use intravenous immunoglobulin, which is basically giving someone an immune product which is made up of antibodies to help control their symptoms. Apart from medications, there are also other things that we can do. We can do physiotherapy to help with the stiffness of the joints, to help with the range of motion. We can also do occupational therapy to help with daily activities, to help with using the right tools and techniques to avoid putting too much strain on the joints. And lastly, in some cases, we might even refer the patient for psychological support because living with a chronic illness can be quite challenging and quite daunting, and at times it can affect a person's mental health. If you found this video useful, please share it with your friends, and I will see you in the next one. Bye-bye.